Today, we are honored to be joined by Dean Adnan Hyder, the Dean and Robert A. Knox Professor of Boston University School of Public Health.
One area of my interest has always been in health systems development, looking at health policy and systems research and how to improve the efficiency and performance of health systems around the world. But I'm truly interested in developing skilled capacity across low and middle income countries and now in this country for public health. And that's really the mission for the next few years. I went from like 10 interests to 3, and 3 was also too much for many people at that time.
You're assessing a candidate. What do you say it makes this candidate stand out?
So,
good morning, good afternoon, everyone. Welcome back to the Scholars Table. This is a podcast where we sit with scholars, leaders, and practitioners to have honest conversations about academia, leadership, public health, and the work behind meaningful careers. I'm Dr. Banda Khalifa. Each episode brings a thoughtful voice to the table to reflect on academic journey, leadership, mentorship, and the decisions that shape long-term impact. Today, we are honored to be joined by Dean Adnan Hyder, the Dean and Robert A. Knox Professor of Boston University School of Public Health. Dean Hyder is a globally recognized physician, scholar, and a public health leader whose work has focused on strengthening health systems, advancing health policy, injury prevention, ethics, and improving health outcomes in low and middle income countries. Boston University, he spent more than 25 years working across Africa, Asia, Latin America, and the Middle East to improve global health. Before joining Boston University School of Public Health, Dean Hyder served as the Senior Associate Dean for Research and Innovation and Professor of Global Health at the George Washington University Milken Institute School of Public Health. He officially joined Boston University as Dean in August 2025. His career reflects the kind of academic leadership we value deeply on the Scholars Table. With Dean Hyder joining us today, the Scholars Table continues its mission of creating space for meaningful conversations with scholars and leaders from world-leading public health institutions. Dean Hyder, welcome and thank you for joining us.
Thank you very much for inviting me. It's a pleasure.
Thank you so much. So I typically like to start off the conversation with your background. So if you don't mind, maybe a brief intro about your professional and academic career.
Sure. First of all, let's start. I'm originally from Pakistan. I became a physician there. I did my medical degree at the Aga Khan University, and I'm a very proud alumnus of that university. And then I came to Johns Hopkins University, where you are located, got my Master's of Public Health and PhD, and then spent 20 years in the faculty. That's an amazing school and university. And then I moved from there to spend 7 years at the George Washington University School of Public Health, where I served as Senior Associate Dean. And then subsequently last year, joined Boston University School of Public Health, where I'm so honored to serve as the Dean of this amazing school. Throughout that time period, I have personally worked on a wide variety of areas, but you covered some. One area of my interest has always been in health systems development, looking at health policy and systems research and how to improve the efficiency and performance of health systems around the world. A second area of work has been in the area of non-communicable diseases, with a strong emphasis on injury and violence prevention. And I've done a considerable amount of work across Africa and Asia, looking at everything from homicides and suicides to road traffic injuries and so on. And then very importantly for me is my third area of work, which is in the area of bioethics, which comes from my interest in social justice and equity, looking at global bioethics in particular, but also developing capacity in research ethics around the world. So that's a little bit of spectrum on my own work, but I'm truly interested in developing skilled capacity across low and middle income countries and now in this country for public health. And that's really the mission for the next few years.
That sounds like an interesting mission. And reading through your profile, I realized that you spent quite a number of years here at Hopkins. So if you don't mind, maybe walk us through your training years, a little bit about your training years and what experiences most shaped your view of what public health education should produce.
Yeah, I think I was really lucky. I applied for the Masters of Public Health and then specifically requested the late Professor Richard Morrow, who used to be Director of Health Systems here. He had just come in from WHO to be a professor at Johns Hopkins. I started doing my Masters of Public Health and then eventually continued with my PhD in Health Systems Development. And it was an amazing journey because Dr. Morrow was not only a superb analyst, a superb thinker, but also a very, very humble man. And I learned a lot from him. And in that process, I got convinced that I am at heart an academic. And so when I finished my PhD, I joined the Bloomberg School of Public Health and the Department of, at that time, International Health, and then grew up there in public health. I think the journey that I've had is not typical because I didn't decide to work on one disease or one topic and just stay in that. But rather, for me, it was very difficult with a wide variety of broad interests to narrow down. Mm-hmm. So I went from like 10 interests to 3. And 3 was also too much for many people at that time. And so part of the problem, of course, was, especially at that time, you had to publish and get grants and teach in all of the fields that you claim to be yours. And so somehow or the other, I managed to be doing grantsmanship and research and service and a little bit of policy development in the area of health systems and in injury and violence and in bioethics. For me, this interdisciplinary linkage was really important. It helped me grow as a professional, but it also allowed me to bring a new perspective into the fields that I was working in. And so I wrote some of the earlier papers on the ethics of injury prevention work. Mm-hmm. I wrote some of the early papers that looked at this notion of where you integrate injury prevention services into health systems in low and middle income countries. So this allowed me to add value to the dialogue and the discourse that was going on in those fields at that time.
Awesome. And, before, I know like most of our listeners are perhaps early career and prospective applicants. But before we go into that, I would like to perhaps hear a little bit about your vision for Boston University School of Public Health in the next 3 to 10 years. I know that most public health applicants would have Boston University on their list. I applied there. Every international student or domestic student applying to School of Public Health will have Boston University on their list. So it's a well-recognized institution. So you assuming as a new dean, what is your strategic vision for the school?
So first of all, I want to start by saying that all the schools of public health in this country are amazing. I have tremendous respect for anyone doing public health at this stage. So if you're a prospective applicant to any one of those programs and schools, good luck to you. You'll be fine no matter where you go. Having said that, I'm really looking to react to how public health is facing potentially a major threat at this point in time. And so the conversation around public health is becoming more and more challenging. There are both internal and external real and perceived threats to public health, but also to science. And especially in this country, that means that we have to do a little bit more. And what that means for the Boston University School of Public Health is that as a top 10 school of public health, we want to make sure that obviously we carry our excellence forward. And that's a given. Our excellence in research, our excellence in public health policy development, and also in service. But I think the times are calling us to go well beyond that and explain our value to society. And that is fundamental because there has been a break in the trust between public health and society in the past 4 or 5 years. And you, having worked in the COVID pandemic, you understand what I'm saying. And this trust has to be restored. And schools of public health have a responsibility to restore this trust, which means that we need to be useful to society. And there are many ways of being useful to society for a school of public health. One of the ways is to produce amazing leaders for tomorrow. Just like you're going to be graduating soon. You will be a leader. You are a leader. Just 2 weeks ago at our graduation, 550 graduates walked the stage at Boston University School of Public Health. These are the leaders that we want to promote and publicize. But beyond that, while they are with us, while people share their lives with us, whether it's a 2-year Master's of Public Health or a 5-year PhD or a 4-year Doctor of Public Health, we want that time to be useful to them, so that they should achieve their vision and their mission, the skill sets that they want. We want it to be great for our school because as teachers, as professors, we want to impart the knowledge and skills that we have gained to the future leaders for tomorrow. And very importantly, we want that process to be useful to our local, national, and global community. And that's the vision that I have for Boston University School of Public Health, that our research, that our policy and practice work, that our service is useful to our stakeholders, first of all in Boston, so that the Boston city recognizes our worth, in the state of Massachusetts where we live, and also, of course, in this country and around the world. And that's a vision, obviously. It's something that we are striving for. We are already doing part of it. But I think we need to do more, we need to do better, and we need to do it with many more partners. So that in a nutshell is the type of vision that we would like to espouse.
Yes. And I think having that vision at this point in time is very important, as you've elaborated on the key challenges that public health is facing currently. The challenges in the, say, 70s and the 80s and the 90s are not currently what is really happening now. So we need to also step up our game. Now, I mean, I've been to Boston once and I fell in love with the city. I was in Boston University, actually. I had a colleague there. I came to the campus and everything. Like, it was really good. So for people who, let's say for prospective applicants who are looking to apply to Boston, what would you say is offered uniquely by Boston, let's say the city and the school, that they can't get in other cities?
Yeah. Well, first of all, I think the attraction to Boston and the attraction to Boston University School of Public Health are both a value proposition that we firmly believe in. Boston is a city with over 50 schools and colleges. It's an academic city. It offers the opportunity to engage with people from around the world in a relatively safe and secure environment. And on days when Boston is cold, our university and our school is very warm. And that's really important for us to remember. Having moved from Baltimore to Boston, I understand that deeply, and the warmth of the people more than often pays for the weather. But I do think that at Boston University School of Public Health, we have a firm and explicit commitment to social justice and equity. Okay. And we do this in our research, we do this in our practice, we do this in our service. We are known for this. Our policy and practice agenda is very strong. I am firmly behind that. We have an activist lab that helps our students get involved in evidence-based advocacy from day one. And that's a very important element for our school that is really, really integral to the experience that our students have there. Second, I'd like to say that actually the teaching that we do at BUSPH also integrates practice. So we are one of the schools where innumerable courses are taught. You may have heard and you've done an MBA, the case-based teaching method. Similarly, there is something called the practice-based teaching methodology, where the class has clients, and within the class, you solve the problems for those clients. So we have real-world clients, and actually, usually in the last or the second last session, those clients are brought into the classroom and the students actually present their solutions. And that has led to amazing developments where, in fact, those solutions have been implemented in healthcare systems in Massachusetts and beyond. And so that practice-based teaching is a very important feature of our school that again, I'm very, very firmly behind. Another aspect of a school is that throughout the school, public health law has been very firmly integrated. Okay. Now, there are schools with courses in specific areas of interest in public health law, but we actually have a department that is called the Department of Health Law, Policy and Management. And so there is integration of those aspects across many functions of the school, and we're very proud of our relationship with the School of Law here at Boston University School of Public Health and with our certification programs that are part of that. And the final thing that I'll say is that we are also very proud of the fact that our graduate placement rates for jobs is over 95% in 6 months. So even today, despite all the challenges that people like you might be facing as you come up to your graduation, our career and practicum office, our student life support systems, our offices at both the School of Public Health and BU-wide are very, very interested in supporting people transitioning into their first job or returning back to work, depending upon the circumstance of each individual student. And we are very proud of those numbers, and I look forward to maintaining them. But that gives you a little bit of the spectrum. In addition to, of course, we offer 17 certificates that people want to offer. We have an ongoing program in new emerging areas like emerging infectious diseases, artificial intelligence, etc. All of that stuff is available.
Awesome. You've painted a very compelling picture for Boston University. I mean, anyone watching us would highly consider the program. But you also mentioned the graduate placement rate, which is a bit fascinating. I don't know if you have the numbers, but in terms of like the areas that most of them typically go to, would you say it's more in government, in academia, NGO, private sector, startups? I know there are a lot of startups in Boston, but
Sure.
What does the distribution looks like for graduates?
So, Banda, the distribution has, first of all, changed over time.
Okay.
So, traditionally, the distribution was that a large proportion went into healthcare systems, then state and local public health offices, USAID, CDC, and so on. Now, that distribution has changed, that people still go into healthcare systems, especially healthcare systems in Boston and Massachusetts and the New England area. But increasingly, people are going into the pharmaceutical sector, into, as you mentioned, startups, into biopharma sectors, into even startups and biotech industries. And I think this is very appropriate because as in the past 2-3 years, the landscape has changed. For example, USAID doesn't exist anymore. So when that type of landscape changes, there's a huge flux, and that flux has to be managed by a reorientation. So industries like Amazon and Google that never would one have conceptualized maybe a decade ago to be responsible for hiring our graduates are actually doing that now. And that's because they have either a tech sector or a health sector or an element of a medical practice that is going on. And so I think that is really important, and we will continue to do our work with respect to trying to place students both as interns and in practica, and then eventually in jobs in emerging sectors, as we like to call them.
Awesome. As we are discussing postgraduate prospects, most people will also want to know how to get into a good program. And I know you've been an associate dean at George Washington for a while, and you're also currently the dean at Boston University. If you're assessing a candidate, what would you say it makes this candidate stand out? Let's say, for example, at the master's level or at the PhD level, what makes a candidate stand out?
So that obviously is a question that in some ways is the crux of every application. Right, every student who applies for public health, from my perspective, I wish there was a world where every person interested in public health could get public health education. And I'll maybe later on in the interview, we can come to that goal. But yes, obviously, basic academics are really important. And one has to be able to demonstrate that you can intellectually and otherwise go through a Masters of Public Health program. All of our accredited programs generally follow a similar core curriculum. You have to understand a bit of epidemiology, a bit of biostatistics, environmental health, etc. So academic prowess is important. Number two, I think it's really important in your application to communicate, whether it is formal or informal, experiences. That could be at the level of an individual, at the level of an organization, at the level of a public sector, private sector, non-governmental organization, but whatever experiences one has had, associated with the public health enterprise, I think it's important to communicate that because it allows us to understand applicants and their lives outside the pure academic world. Okay. But I think a third factor, which is really important, is that somehow communicating your passion, whatever that passion is. Maybe that passion is to understand the most important regression equation, and that's your passion. Mm-hmm. Or maybe the passion is to change the world with respect to hypertension. Or maybe the passion is to build a healthcare system in Ghana. Well, whatever the passion is, it must come out. Because when we read applications, and historically, of course, I've done that at other institutions, something has to stand out and something attracts you to an application. Yeah. And so the more attraction you can have for us, maybe it's innovation, maybe it's an experience, maybe it's the way you speak in your personal statement. I think it's incredibly important to allow people to know who you are and what your goals are going to be. And let me close this question by saying that every school is not okay for everyone.
Yes.
And so the question is, how do you find the school which is best fit for you? And maybe Hopkins is best for one person, and GW is good for another person, and Emory is good for a third person, and Minnesota is great for a fourth person. And everything is okay because everybody finds their home. And so the same home doesn't work for everybody. And that's very important to remember as an applicant, that the search is for you to find your right fit.
Yes. I think that also comes down to another important area, especially for, I would say, international students who are applying to US programs. I mean, aside the visa restrictions and the rest, there's also an issue of funding or scholarships. I know Boston is quite generous in offering funding to some of their students. I think when I applied, I got like 50% scholarship for my master's. How has the funding structure changed? Is it now better for master students, for PhD, DRPH? How
Sure.
are the funding opportunities there at Boston?
So, having been an international student and having gone through those questions 35 years ago, I think you've raised a very, very important and very sensitive issue, because not only is it, first of all, generally, it is not just a question of international, but even domestic students.
Yeah.
I think it's very important to understand that the cost of graduate education is enormous, and people end up domestically and internationally taking loans and looking for scholarships. Certainly, if you are a local or a national, the opportunity to do that is a little bit more compared to when you are not. And therefore, the acuity and the challenges are higher when you are an international student. And I would have loved to say, Banda, that things have changed and every student will be able to afford their education. But we are having challenges. All schools of public health struggle with this. And this is really important for our international students, I'm aware. We try and do our best. In fact, one of my immediate goals over the next year or two is to raise money for scholarships. And so I'm trying to meet donors and foundations and industry and promote scholarships and funding, not to pay the school, but for our international and domestic students who cannot afford to be there. I think this is an area where international students are also facing more challenging compared to the times when I applied, because in the 90s and the 2000s and so on, there were government scholarships, there were Fulbright scholarships and USAID scholarships and WHO fellowships and Aga Khan Foundation's fellowships, etc., that allowed some of us to pay for our education. And even some of those have gone away. And so I do recognize that is even a more challenging situation. So I think this is something for all of us to think about. It is an issue of global equity, that education access should be equitable. It is a question, of course, where, if I may use the question, Banda, to raise this notion, where the question has also been raised that the opportunity for those students to get high quality public health education in their own countries should also be developed. Which is why when we have a Masters of Public Health in Pakistan at Aga Khan University, or at the Jim Grant School in Brack University in Bangladesh, or my dear colleagues at Makerere University School of Public Health in Uganda, they are offering an amazing, amazing product that I have tremendous respect for. And finally, I'll say, Banda, this is the one reason where in February this year, we have relaunched an online Masters of Public Health at Boston University School of Public Health, which comes at the glorious price tag of only $25,000. So you can stay in your home and you can do this in 1, 2, 3, or 4 years, depending on your job, depending on what you're doing, at your pace. You never have to leave your house, and all you pay from start to finish is $25,000. That's for a Masters of Public Health from a top 10 school in the US, if that is what you want, if you want to get that type of degree.
Yeah. I think that option is especially practical. For example, mid-career professionals who are already doing work and they want to advance their career. So that is certainly an important option to have. Before we perhaps end, I think we have to talk a little bit about the future of public health training. We all know the current challenges that we are facing. So I know, like, if I'd asked you this question 10 years ago, the answer might be different. But in 2026, what do you believe public health graduates, the skills that they should possess if they want to succeed in 2026 and beyond?
So, Banda, first, let me tell you that when people ask me, they'll either ask me why I left clinical medicine to go into public health, or why did I choose to do a PhD in public health. Generally, my answer is that the analytic thinking that public health trains you in is the most important asset. It allows you to deconstruct complex problems and then begin to build solutions to those individual components and bring them together in order to present a solution to highly complicated problems that the world is facing, in our case, in public health. That value proposition for public health training still remains, because public health training still, and again, irrespective of where you get that public health training, I hope will allow you the skill sets to think analytically about an issue and say, this is the problem in front of me, whether it's a problem in pharma or a problem in a state health department or in a hospital, and to be able to deconstruct it and analyze it and use the skill sets and tools of public health, whether it comes from epidemiology or demography or health management or health policy, and solve the problem. Because fundamentally, public health professionals are problem solvers. Yeah. And problem solving is our profession. Now, it is true that in 2026, the challenges that are confronting the field of public health, some may say more acute than the ones maybe in 1996 or in 2006. But I think public health training and the public health profession should always remain true to its value system. And the value system that we believe in is social justice and equity. We believe that every single person on this earth should have the opportunity to be healthy. And if systems are not allowing that, then we should do something about it to change it. And that could be in the spectrum of a disease-based healthcare system, or it could be in the spectrum of health financing. It could be in the spectrum of social determinants of health or commercial determinants of health, whatever aspect of public health you face. So for me, the future of public health is bright despite the challenges. And it's bright because I believe that our future leaders, our graduates, are better able to cope with these complexities than we did. We are trying our best to prepare them, but I have a much higher hope from the next generation than I did of the previous generation. And I think that in general, our graduates from all our schools of public health have the energy, have the intelligence, have the motivation to help solve some of these larger problems. Now, while I say this in the spirit of optimism, of course there are challenges. There are the challenges which you just mentioned: international students, visa restrictions, funding. We have challenges in funding our own research from our local organizations like NIH, like CDC, etc. We will face those challenges. We will face those challenges not because we have to, but because it is critical for the survival of our field, because we believe in the power of public health, because we believe that social justice and equity are important. And so we are going to fight for this. We are going to survive. And you all are going to lead us into the next century with an amazing field of public health. And from Boston University School of Public Health, we are going to do what we can to support that.
Awesome. One question I get most in my DMs is people asking, is public health worth it in 2026? So maybe I'll defer the question to you as the Dean of Boston University. Do you think public health degree is worth it for those who are exploring careers in public health?
Like for medical degrees, the assessment of worth depends upon your metric and your unit. Mm-hmm. If the assessment of your metric and your unit, for example, is income earned, then it depends on where you go. If you join the pharmaceutical sector, the private sector, the industry, I think probably is very worth it. If you join the non-governmental organization sector, or for that matter, academics, we don't join academics for that particular metric. Now, if your metric is impact on people's lives, then I'm going to tell you, boy, oh boy, is it going to be worth it. Because you're going to be able to impact people's life, whether you work in the industry, whether you work in a city health department, or you work in the state health department, or you work helping bring a molecule to the discovery of a drug. or you help a healthcare system and help that healthcare system reach access to populations that don't have healthcare access. It's going to be worth it. If your metric and your measurement is based on reputational returns or strategic engagement or public engagement, then absolutely we are worth it. Because public health professionals are ministers and secretaries of health, they are director generals of health, they are leading large research institutions, they're even leading schools of public health and schools of medicine. And so, if that's your metric, then absolutely it's going to be worth it. I think that this question really has those two elements. One is, what is your internal worth of what you do? I will tell you, because I can answer only for myself. I get up excited every single day for the past 35 years because I love what I do. I do not consider this a job. Public health is my life. I'm very, very passionate about it. I do this because I love it. Even when I'm having a tough day, even when I'm facing extreme challenges, I'm in the space that I wanted to be in, and I would not change it. And that's really important for each one of us to answer. So it's a question that I'm going to throw right back at each one of those people who DM'd you and say, this is something for you to think about. But we are very happy.
Okay, well, you're speaking to thousands of emerging leaders globally who will be listening to this podcast. What must they understand about what it truly takes to lead in public health?
So I really believed, Banda, that in my life and in what I like to tell people, three things emerged, and I call them my SOPs. And my SOPs are: number one, you have to have strategy. Number two, you have to have some sort of opportunity. And then you have to have passion. And when you combine strategy with an opportunity and you bring your passion to it, you will emerge. Leaders are not because you are given a title. Leaders are because you recognize the responsibility that something is needed, some action is needed, some work is needed. You accept that responsibility and then you follow it up with accountability. Mm-hmm. Leadership without accountability is really all about oneself. And that doesn't make any sense. And so the two go together. And I think it's incredibly important for people to understand that every person is born fundamentally with a mission. And you can be a leader no matter what scale, what focus, what shape you're in. Leadership is recognized because you bring value to the table. Mm-hmm. And when you bring value to the table, people will want to listen to you, they will want to engage with you, they will want you to lead them. And that is fundamental to this notion of leadership. Yes, you can be trained in it, you can have degrees, you can have titles. But there are many people with title who people don't want to work for. There are many people without titles that people love. And that's the premise that we have to always remember, that it is incredibly important to have one's own compass, one's own leadership and moral compass straight. And I think those are the elements that we can all develop over time.
Awesome. That brings us to the final session of the podcast, which is more like a rapid fire. I ask very short questions and get very short answers. So my first question is a book that you gift very often or recommend to upcoming leaders.
Yeah, there's a book called Difficult Conversations. And that is really important. How to handle difficult conversations is not something that comes easy to many people. Mm. And I highly recommend that.
Yeah, especially these times. Okay. One leadership rule you follow that most people ignore.
That I had to learn. And that rule is that listen more than you speak. And that is very important for leaders. And that sometimes doesn't come easy for people. And I think that, but one can learn on it.
Okay. A public health buzzword you retire permanently.
Wow, that's very, very difficult. Because I love all my buzzwords, whether it's collaboration, but I do think this notion of intersectorality, I think we need to come up with new words, new ideas, and new frameworks for this intersectoral work. I think it's lost its public resonance.
Okay. Best advice you give, but something you struggle to follow.
Oh, easy. Work-life balance. No.
Ah, okay, favorite way to reset after a high stakes week.
Oh, be with my children. That's the best way for me.
Okay. Something people would not guess from your CV. So I asked this question to the Dean of Hopkins, and she was like, she has a black belt in Taekwondo. And then I asked the head of department of EP at Harvard, and he was like, he's a boxing instructor. So that
Wow.
caught me off guard. So is there anything you do often that people would not guess from your resume?
Well, I don't know if people will guess this or not, but I'm an avid exerciser. So I exercise every day. It's like medicine for me. I'm
Okay.
very, very passionate about it. No matter where I am in the world, I travel, I choose my hotels based on their fitness or gym. And I must get that done. Otherwise, I don't get reset, not balanced.
Okay. We'll fill in the blank. Public health leadership in 2026 requires,
Grit and determination.
that is very powerful. If you could give your younger self one warning about academia, what would it be?
It would be that there are political determinants within academia as well. And so one must not assume that academics doesn't have political determinants of success.
Okay. All right. Well, that brings us to the end of the episode. But before we go, any final words to prospective applicants, early career professionals, and even advanced careers who are watching us today?
I think it's really important for all of you to pursue your public health passion, no matter where you do it. If you give us the opportunity here at Boston University School of Public Health, it would be a pleasure, a delight, and we would certainly add value. But I would hate to see you leave the field of public health just because one school doesn't admit you or doesn't allow the opportunity. Stay in the field, stay with your passion, and be a member of our collegiate and be our colleague no matter where you are.
Thank you so much for joining us. This is the Scholars Table with Dean Hyder, the Dean of Boston University School of Public Health. If this is the first time you're watching or listening to us, we are live on YouTube, also on LinkedIn, Apple, and Spotify podcast. Until next time, bye-bye.